Come on guys, we're a bit slow here.
What's the story? What's the story?
You coming in?
I don't want to get coronavirus.
So I've got an 8-month-old.
So I can't hear. Hang on, say that again.
I've got an 8-month-old baby called
Yeah.
Jack. Came in with parents self-isolating at home, so that's why we're isolating. He's come in poor feeding, temperature, and wheeze in originally 2 litres of oxygen, had prolonged apnea.
Sorry, say that last bit. 2 litres of oxygen and...
Yeah, and I've just come in to do routine set of, he's had apneas, occasionally lasting 10 to 15 seconds.
Yeah.
And he's just looking a bit dusky, not great.
Okay.
Ideally, I wouldn't have pulled the buzzer, but I needed attention.
No, that's okay.
So stats are now 84, heart rate's 128.
Yeah. And how old did you say?
Is that rest? 39?
Yeah, that can be rest.
That's which rate today.
And how old is he?
8 months.
8 months.
8 months.
So within 15 litres of oxygen currently, and stats still 84. I've got a cannula in left hand, saxophone on the wrist.
Okay. What was what have you got in the room?
I've got back valve mask. And
Is
that's
that
it.
the spirit?
Yeah, if you've been told that you
No.
don't.
It is.
So can someone just get the cash trolley ready? Guys, can someone get the cash trolley? Guys, please. Can someone get the cash trolley ready? Let anaesthetics know who they are. Yeah.
Yeah,
But tell them
hospital
there's a suspected COVID.
So airway's patent. It's quite a lot of upper airway secretions and froth.
Okay, are we alright to suction? Is that okay? So Danielle, she's going to have one of these masks on. So the next person,
What are these?
the next person into the room, can bring Danielle another mask. Is that alright?
I think they were just these ones, aren't we? Suspected?
Don't look at me. You're the team.
Yeah, so at the moment, so
Yeah,
suspected.
this is very stats are going down to breathing.
Sorry, you're going to have to speak up because we all learn it's hard to hear you.
Breathing.
Breathing wise, so they're tachypneic, but then intermittently having apneas of about 5 to 10 seconds.
Yeah, okay. And working.
But breathing is increased most of the time, yeah.
And heart sounds. And can one of you do the wet flag calculations?
Say that again.
Can one of you do the wet flag calculations?
The wet what?
Wet flag! Wet flag!
And heart sounds?
So I'm just listening to the heart sounds, they sound normal.
Okay. And pulses?
Yeah. Pulses are normal.
And pupils and sort of responsiveness?
Pupils are reactive. Baby just looks quiet and unwell.
Yeah. And any signs of any rashes or anything?
So if you undress him and you can have a look, but no, there's no
We haven't
signs
got
of.
any more masks.
I've got some more if we need some.
So, okay, fine. All right. So we think our primary problem is respiratory.
Yeah.
So because we're worried that this might be a potential COVID case, then if we think the baby's having lots of apneas and the stats are going down quickly, then the best thing would be to intubate the baby rather than doing anything else. So
8 months.
8 months.
we've called for anaesthetics or anything?
Yeah, the call's been put up.
Okay.
Yeah, so I'm the adult anaesthetist. I've come down from ITU. We're really flat out.
Yeah.
I've never done a child this small for 15 years.
Okay.
I'm happy to help with drugs or anything that you need, but yeah, I can't do any airway stuff, and that's
So,
more. You're probably better suited than me.
okay, so if I try for an ET tube and then if you run a couple of minutes, would you be able to give me some assistance?
Okay, yeah, no worries. Do you want me to make up any drugs or anything, or I can get the ODP down, or perhaps. Yeah. All right.
And I've called a paediatric consultant as well.
Yeah. Okay. Yeah. Pediatric consultant will be called. Who do you want to call them?
Are you happy with 8 months as 9 kilo? Or do you want it, like, it's obviously, the newborn is 5.
Yeah. Yeah.
9, 10?
Yeah. No.
Should we go for 10?
Do you want a towel roll under
Peds consultant for me.
shoulder?
helpful.
And then towel. To put under the shoulders.
Okay. Can we get and then in terms of, are we bringing this in or?
Yeah.
Okay, so do you want to ask for the ET tube?
That's now 69. Do you want me to bag so you can kind of... Well, we'll just pretend because we don't have any more. So I'll change my
So you've got a couple of bags.
What equipment do you want, Michelle?
Yeah.
I can get that out of the trolley.
Yours is basic up here. All these are not wearing they should be wearing that one as well. Now they're not wearing it. They're both integrated with the otherwise.
Do you want this towel and then we can go through? Do you want 20 of stone line? How much is that? So 200.
They've got a weak pulse at the rate that you can see. I put it on the bed for you. You've got a tube and you've got that.
And then you put out the cash, please.
So the call's gone out and everyone is too busy to...
Can you actually intubate this one?
You can intubate that one. They're a little bit difficult.
And then should we get some adrenaline from that?
Just take any old syringe out, mate. Second drawer.
Oh, we should have that filter thing, the cleaning filter.
What filter do you want?
No, you would ask me that. You're an anaesthetist.
I'm an anaesthetist. You want an extra me, don't you? Let me just see if I've got one. See, that's where you're from.
What's our adrenaline?
On 20 kilo per
Oh,
bag.
yeah, so adrenaline on a wet bag is 1 mil.
I think we should be having them from upstairs as well.
And then,
Not sure that fit.
and then we'll need to get some more access as well, so, first agenda, got it in.
I'm just going to document.
And flash.
So airway at the moment,
Two,
2. ET tube size,
just at 4, I think 3.5. Just listen to the chest for me.
saturations,
60.
respiratory rate.
170.
No,
40. Oh, sorry,
What is it, sorry?
41.
So you've got equal air entry when you listen to the chest. Quite crackly.
Heart rate,
And
169.
then, so there's the, yeah, no, sorry.
Rhythm.
Idea.
So they had a dose of Carmoxyclav in ED,
Yeah.
Oh, yeah.
but it's up to you what you want to do with that.
Should we give those of
Okay,
Cat?
yeah. Refill.
And yeah, the rest of circulation, so really
So CRT's 4 seconds at the moment, and they still look a bit pale.
So should we say we do 80 kilos? And should we give another 20 more kilos to
Yeah.
And then if someone's got a spare hand, can you secure the ET tube for me, please?
So we can do it.
One cannula, we're going to get another access. Are you happy with putting an island? Yeah. So yeah. Can you see a vein? Can you see anything for you?
Can't see anything peripherally.
Just go for it.
No.
What do you want to secure the ET tube with?
I need to be writing, yeah.
Tapes and things.
You want to do tapes? You can do tapes if you want to do tapes.
Or you can do tape.
Oh, yeah.
So we just cut tape
You can
apart
do it,
and
yeah.
wrap round.
I normally just let the ODP do this bit. I mean, it's not something I'm used to. Yeah, they just haven't turned up yet.
I'm stepping up to the ED. We've got scissors. We've got scissors.
Have you got the iron? Can you get the iron?
What do you need, Emma? So you can use your imagination for an IO. We all know how an IO goes, yeah. Yeah.
And then after
So-
the bolus will hang on the
So that's
outside.
so girls. Girls.
Yes.
The second blue bolus going in.
Yeah, beautiful. So how many have we given so far?
This is our second
Right. And how many lots of adrenaline have we given?
one. And we're then going to follow with 18 of chemo as the triathlon.
So fluid bolus.
And antibiotics that come in. Really hard.
Do you know how to do this? I'm impressed.
Was it 20 for kilo?
If I can remember it, my EPS. So when we just do another reassessment, just listen to the chest.
So chest is moving well on your back. Crappy on both sides.
And what are you giving? Lorazepam?
What? No.
I don't know what you're doing. I don't know what you say you're doing.
Still 4 seconds. Any femoral pulse is still palpable. Good volumes. That's interesting.
Yeah, well, but you can go through that IO. Oh yeah, that's it. Got back up, back up. And was that the antibiotics?
Yeah, yeah.
So your patient's looking a bit more stable now. They're ventilating nicely. What's your plan?
A nice friend needs to put the baby on the ventilator, so that's just
Yeah, okay. What ventilator do you want? Because I don't do kids, so I'm not really sure what we've got. Just come back from retirement.
the baby pack or whatever.
Okay. Yeah, we'll get your baby pack down here. Okay, fine.
And then we'll need an X-ray to confirm true position and state the chest.
Yep.
And then obviously to let the cats to or whoever is going to take the baby somewhere.
Cool. All right, I'll stop you there.
Okay, are we alright to section, is that okay? So Danielle, she's going to have one of these masks on. So the next person,
What are these?
the next person interviewed can bring Danielle another mask, is that right?
I think they were just these ones, aren't we? Suspected.
Don't look at me. You're the team.
Yeah, so at the moment, this is
Yeah,
expected, this is very
The recommended PPE components: gown, alcohol hand rub, gloves in the correct sizes, visor, goggles, respirator or respiratory protection.
I've got background mask,
And that's it.
Yeah, if you've been told that you
Before putting on PPE, perform hand hygiene. Step 1. Put on a long rear-fastening fluid-resistant and long-sleeve disposable gown. Do not use the inside tie, but fasten the necktie with Velcro and then the waist ties. Make sure the gown is securely fitted at the neck and waist ties. If glasses are worn, remove glasses before donning the respirator. Clean them with an alcohol lens wipe and replace before donning the visor. Step 2. Put on disposable FFP3 respirator and check for fit. This must be the respirator that the healthcare worker is face fit tested to use. The FFP3 respirator must be compatible with other facial protection, e.g. your full face visor. If you have not been fit tested for the FFP3 respirator, you must not enter the patient's room. Position the upper straps on the crown of your head, above the ears, and the lower strap at the nape of the neck. Ensure that the respirator is flat against your cheeks. With both hands, mould the nose piece down from the bridge of the nose, firmly pressing down both sides of the nose with your fingers until you have a good facial fit. Always perform a fit check before entering the work area. A successful fit check is when there is no air leaking from the edges of the respirator. For an unvalved product, exhale sharply to test. For a valved product, inhale sharply. If air flows around the nose, readjust the nose piece. If air flows around the edges of the respirator, readjust the headbands. If you still cannot obtain a successful fit check, do not enter the work area. Once the respirator is fitted, replace the glasses before fitting your face protection. Step 3. Put on your eye protection. A disposable full-face visor is preferred. Goggles may be used if a visor is not available. If using a visor, ensure it covers all of your face, including your chin. Adjust the headband if necessary. If a buddy is not available, you will need visual confirmation that the visor is in the correct position. Step 4. Put on a pair of non-sterile nitrile gloves. These need to be available in the correct size. Ensure the gloves cover the cuffs of the gown completely. You should now check all items are in place. So make sure that you check that the gown ties at the neck and waist are secure, the respirator is correctly fitted, the visor is in position, and the gloves cover the cuffs. Once you are happy that all steps have been completed properly, you are now ready to enter the patient area. Step 5. When donning PPE has been completed, proceed to enter the patient's room. After entering the patient's room, remain vigilant of PPE integrity for yourself and any other staff members.
And heart sounds. And can one of you do the wet flag calculations?
Say that again.
Can one of you do the wet flag calculations?
The wet what?
Wet flag!
Yeah.
Wet flag!
And heart sounds.
So
Are you happy with 8 months as 9 kilo? Or do you want it, like, it's obviously, the newborn is 5.
Yeah. Yeah.
9, 10?
Yeah.
Should
No.
we go for 10?
Then
now, hardest bit of the whole thing, I want you all to take off your PPE in a suitable Public Health England docking fashion. Think about where you want to take it off, how you're going to take it off, and we will tell you.
We just take our PPE off.
Gosh,
The clips have to do it on, okay?
We'll
So
find out.
then I think we need to shut these doors.
The baby isn't safe.
Shut the door!
Who's coming first then?
Got a new shoe.
Go on then, show me how it's done. Yes. Okay, yeah, yeah.
Oh, yeah, right your way.
You feel the belly on the phone? Okay. Yeah, she'll be free in like 3 minutes. Cool. Your team can help you,
yes,
you are a
put your
team.
gown off, under it.
Gown off
Under it at
first.
the neck first.
It's not a glove.
No, no, it's your gown, under it at the neck.
Yeah.
So, yeah, let it pull forward. Now your waist ties. Just try and untie rather than. And then you fold it up. So you don't touch the outside. So just leave it right there as well. Put it in the bin.
I thought the house is
And then your glove next. So you don't touch the
Outside. Well, I touch the outside with
Yeah,
some
put it
like
on.
that.
Yeah. And then put it inside. Yeah. Okay. And then wash your hands. And then face mask if you unpeel like this, bending forward a little bit, and then run to your mouth.
Yeah, yeah. Very nice. Cool. You go that way.
Removing PPE, step 1. The outside of the gloves are contaminated. To safely remove the gloves, the healthcare worker will grasp the outside of the glove with the opposite gloved hand, peel off, hold the removed glove in the gloved hand. The healthcare worker now slides the fingers of the ungloved hand under the remaining glove at the wrist. They then peel the remaining glove off over the first glove and dispose of the gloves in the clinical waste bin. Now clean your hands with alcohol hand gel or rub. Removing PPE, step 2. The gown should be removed slowly and carefully. First undo the necktie, then undo the waist tie. Now pull gown away from the neck and shoulders, touching the inside of the gown only, using a peeling motion, as the outside of the gown will be contaminated. Finally, turn the gown inside out, fold or roll into a bundle, and discard into the waste bin. Removing PPE, step 3. To remove the visor, stand straight. Do not bend forwards, as this brings the bottom of the visor in contact with the clean upper body. Reach for the elastic strap at the back of the head, close your eyes, and lift the strap upwards, then over the head using both hands. Place the visor into the clinical waste bin. Now leave the patient room wearing your respirator. Now clean your hands again with alcohol hand gel or rub. If glasses are worn, remove the glasses before doffing the respirator. Clean them with an alcohol wipe. Do not put them back on until you have completed doffing and washed your hands. Removing PPE, step 4. After leaving the patient room, carefully and slowly remove the FFP3 respirator without touching the front of the respirator, which is contaminated. To do this, reach to the back of the head with both hands to find the bottom strap and bring it up to the top strap. Then lift both straps over the top of the head. Let the respirator fall away from your face and drop into the clinical waste bin. Now that all PPE has been removed safely and placed in the clinical waste bin, you can step out of the designated doffing area. Immediately wash your hands with soap and water. You have now safely completed the doffing of PPE equipment for COVID-19.
We've got everybody? Cool. So who's infected?
Everyone.
But who's it? Danielle, you're definitely infected because you've done several aerosol generating procedures without proper PPE.
Well, I was pretending to put the real mask on.
Okay. But you're still infected even if you put the real mask on.
Am I?
Because you had a pinion, so all of your clothes are contaminated.
Right.
You had no visor protection, So you've got potential face exposure, and yeah, the wrong mask on.
Yeah.
Okay. Who else is infected?
I think his mask was upside down.
Your mask was upside down, so you're definitely infected. There's an important lesson to learn there when it comes to fitting the masks. Okay. Infected, not infected?
Infected, we
What?
didn't have eyes.
Yeah. You've got you've got a visor on there.
The mask is loose fitting as well.
Yeah.
Very loose fitting.
Yeah, okay. So it's important basic lessons. So for an emergency, if an isolated patient, you should be in full PPE. Okay, so that is a set of gloves, a surgical gown, a visor if you're going to be anywhere near them for aerosol generating procedures, which you can expect in an emergency of some form or another, and a FFP3 mask, which must be moulded to your nose and you must be fit tested. Okay, so that's important. Okay. Now there are times when you're not going to have the luxury to know what you're going to, in which case if you're going to resus or you're going to an isolation room for an emergency, you should put them on before you go in the room. There are times where it might change. So you might come in and you all come in and you've noticed that actually Danielle's not ready for intubation, you stop, you wait for your entire team to be safe and you brief before you do it. Okay. So yes, it's difficult, you're under pressure, there's time element to it, but you need to brief for it. So you say, we are going to do an intubation, it's an aerosol generating procedure, they're potentially COVID, everyone got their PPE on, everyone check each other, then you proceed. Okay? It's not a criticism, this is just what we're learning.
So I would go out and
You would have to go out.
change.
Okay?
Yeah.
And actually you could limit the amount of people in that room. Okay? Who else is infected? Because there's a lot of other people that are potentially infected at the moment.
The anaesthetist.
The anaesthetist, yeah, that's fine. I was thinking of you having an anaesthetist, made it a little bit easier. There's a whole lot of people that were
So
potentially.
because we have the doors open.
You had all of the doors open. Yeah, so half the ward is now potentially exposed. So this is a negative pressure room, and we have 4 of them. But they only work with the doors closed, and they only work if you use the doors like an airlock. So you come in, you don, you then enter the second doors with the outside doors closed, and then you do your case. Okay? Now that gives some really big difficulties. So what we did last time is we did it with the doors closed, and we couldn't communicate with the ward at all. So anytime we needed anyone, we just had to keep pulling the emergency buzzer. And the other issue is we didn't have very many people last time, so people had to doff, go and get the arrest trolley, come back, re-don a PPE and come back in, and it's really difficult, and I haven't got an easy answer for that.
I suppose what we could do actually, because everyone's got mobile phones, is have like video, isn't it? And then
Yeah, so you could video, but then your phone will be contaminated.
but then doesn't wipe it out.
in the middle.
What do you mean video?
So
I mean, like
so
a video call.
yes.
So you can,
So potentially you could put someone in PPE in the airlock that can go in and out. It's still not perfect, but actually you're far less likely to be contaminated if you're in the airlock a couple of metres away. Okay, so that's something to learn from this, I think, is important.
Yeah, and that person can be having full BPE, and the outside persons applying can also be in BPE, but they can pass things on.
Yeah. So what aerosol generating procedures did we do?
suction.
Open suctioning is an aerosol generating procedure. You put that in and they cut it all over you.
Like
Yeah.
a mask.
Yeah. Okay. So there isn't much you can do about suction, if I'm really honest. If you have to suction the airway because it's occluded, you have to suction the airway, so you just wear your FFP3. Bag valve mask is debatable. So the adults are at the moment are doing so their intubations are without bagging.
Yeah.
Okay. Again, and their arrests are without bagging, so chest compressions only. So we're a little bit difficult in that actually, I think by and large I believe that paediatrics, if they arrest, they should be bagged because we have respiratory arrests, and that's what we've decided at the moment until we're told otherwise. Bag valve masking is sometimes needed because you haven't got an anaesthetic circuit, you have no closed circuits. And on a bag valve mask, where will the viruses come out?
Anywhere that's not closed, so it comes out
And
the
then that.
So if you push hard enough, it'll come out there. But actually, by and large, that's just the oxygen from the reservoir bag. Okay. When you exhale from the front here, so it's going to contaminate everything in that area when it comes to the patient. So this blue membrane is where the exhalation comes up. Okay. You'll also with an ET tube and leak. Because we don't use coffee tubes as a first line in babies. Although it would be reasonable if you have the skills or you have an anaesthetist skills to have a coffee tube in to reduce that closed circuit. Okay. Fine. Anybody not sure what this is? Seen this before? What is it? Yeah, a filter for what?
Anything come in?
Yeah, so it's called an HME. You normally have it on a ventilator set, but to stop you contaminating the internal workings of the ventilator. This is the one from the trolley that probably didn't get replaced in the trial. So one thing, it doesn't cause a lot of resistance. It's designed to let air through it. It filters viruses and bacteria, and you can put it on the end of an ET tube. So now when you're babbling and they're exhaling, you filter before it leaks from here. It will still leak around the tube a bit, but I think that's a reasonable thing if you have it to reduce contamination of your teeth. Okay. Perfect.
Will it fit on the neonatal neopuff? It should, isn't it?
It will do. They're all the same
Yeah,
fittings,
yeah.
so it is reasonable. It means you're more likely to lose your tube, but it is a reasonable thing to do. Okay. Fine.